Cancer is a complex disease. It's important to understand the basics. Our bodies are made up of trillions of cells. Cells grow and divide to form new cells. This process is usually tightly controlled. Cancer happens when cells start to grow uncontrollably. These abnormal cells form a mass called a tumor. Tumors can be benign or malignant. Benign tumors are not cancer. They grow slowly and usually don't spread. Malignant tumors are cancerous. They can grow quickly and invade nearby tissues. Cancer cells can also break away from the tumor and spread to other parts of the body. This spreading is called metastasis. It makes cancer more difficult to treat. Cancer can affect any part of the body. Different types of cancer have different causes and treatments. Glioblastoma is a type of brain cancer. It starts in glial cells, which support and protect nerve cells in the brain. Glioblastoma is considered the most aggressive type of brain cancer. This is because it grows very quickly and spreads rapidly. Glioblastoma tumors have finger-like projections that invade surrounding brain tissue. This makes surgery to remove the tumor very difficult. Glioblastoma cells also divide rapidly and are very resistant to treatment. The exact cause of glioblastoma is unknown. Some risk factors may include radiation exposure and certain genetic conditions. More research is needed to understand what causes this devastating disease. The symptoms of glioblastoma can vary depending on the size and location of the tumor. Common symptoms include headaches, seizures, and weakness on one side of the body. Other symptoms may include personality changes, difficulty speaking, and vision problems. Diagnosing glioblastoma usually starts with a neurological exam. This checks for problems with vision, balance, coordination, and reflexes. Imaging tests, such as MRI scans, are used to get a detailed picture of the brain. A biopsy is often done to confirm the diagnosis. During a biopsy, a small sample of the tumor is removed and examined under a microscope. Early diagnosis is crucial for glioblastoma. The earlier the diagnosis, the sooner treatment can begin. However, glioblastoma is often diagnosed at a late stage because the symptoms can be vague and similar to other conditions. Treatment for glioblastoma typically involves a combination of therapies. Surgery is often the first step if possible. The goal of surgery is to remove as much of the tumor as possible. However, complete removal is often not possible due to the invasive nature of the tumor. Radiation therapy uses high-energy rays to kill cancer cells. It is usually given after surgery to target any remaining tumor cells. Chemotherapy uses drugs to kill cancer cells. It can be given orally or intravenously. Other treatment options include targeted therapy and clinical trials. The prognosis for glioblastoma remains poor. The average survival time after diagnosis is about 15 to 20 months. However, new treatments and clinical trials offer hope for the future. Research is ongoing to develop more effective treatments and improve survival rates. Increased awareness of glioblastoma is essential to encourage early diagnosis and support research efforts.